guest is Dr. MKanu3, and of course the topic is President Obama's health plan. And of course, Dr. Kanu, let me sort of bring us back into this third segment by having you to deal with what we consider to be one of the major health problems, and that is problems with many of our young children, so-called childhood obesity. And I think that you've already mentioned the importance of prevention, and so let's see if we might be able to tie those two together during the last part of this particular show.
Sure, absolutely. Obesity is a very big problem, not just for the state of Tennessee, for example, but this is a national crisis, you know, and it's very important, you know, to understand that how big a problem that is, to try to understand what are the determinants, you know, what are the things that cause this kind of problem. Well, we know them, you know, and that's the important thing. You know, we think we know this information. The information is out there, but sometimes you hear people talk about how do we actually translate research to practice.
Okay.
You know, that's always a problem. But let's step back and look at the obesity issue that you just talked about. What are the factors if you are to address this particular problem in a significant way? What do we do? Well, obviously, we know that diet is a very serious problem. What do we give our youngsters to eat? You know, that's very important. And then we talk about physical activity, which is the other component to this. You know, how much physical activity is good? You know, we need to talk about all of how far we've come along. You know, there have been times when people think, you know, exercise has to be very vigorous before it can produce health benefits, you know, which was a factor that for a very long time made it very difficult for people to exercise. That was number one. Number two, they also argued, or there was this misconception, I should say, that leisure time physical activity has to be done in one block of time.
Okay.
And if you don't do it that way, again, you don't have the benefits that are associated with that. All of that is very fallacious. We know now.
Okay.
So in other words, what we are saying is that you can exercise in 5, 10 different bouts of times, you know, and cumulatively that is going to give you health benefits. You know, so again, the important thing when we talk about the problem of obesity is that we have to make sure that our kids exercise. We have to make sure that our kids eat well. Now, of course, there is a third component to this, you know, which is the genetic factor.
Okay.
What are you born with? You know, there are some kids, you know, some of us come from families where parents are who they are, a little bit heavy set, but, you know, some of the other too, you know, maybe we cannot do much about the genetic factor because that's a non-modifiable factor. But exercise as well as what we eat, those are things that we can actually control. And so again, that takes us back to the issue of prevention, as I said earlier on. How do we prevent some of these issues? We see the correlation now between lack of exercise, for example, with the number of diabetic youngsters these days. Something which used to be for more seniors, you know, seniors or people who are elderly, you know, childhood obesity,
diabetes,
diabetes now, exactly.
Yeah, good.
You know, and these are very serious problems now. So we have to look at environmental factors. We have to pay attention to those factors that are modifiable. These are ones that we can change. So again, it goes back to what I said earlier on about looking at the public health model, which is more about prevention, as opposed to the clinical model. Now, these are two aspects of the same thing. I'm not suggesting here that they are exclusive, you know, or mutually exclusive. They are supposed to complement each other. So in other words, if we emphasize prevention, you know, there are some things that we will not catch. You know, so those that will slip through the crack, hopefully, will be able to catch and be able to treat in a clinical setting. And I think one of the problems that we've had as a nation is the belief that we can treat everything from a clinical point of view. You know, I can do what I need to do. I'll eat what I need to eat or what I want to eat. If I get sick, I'll go to my doctor. And I'll go to the hospital and we can take care of that. Well, of course, you know, there are some diseases that we can manage. You know, but once we have them, we really can't eradicate them again. What is the important message? The important message is that if you have a disease that is not going to kill you immediately, but it's going to be there for a very long time, yes, you can manage it. But guess what? You are going to compromise the quality of life that you live. So again, these are very important issues. So if you go back to the plan that we were talking about, All of these components are there. What I gave you earlier on, the 8-point plan is just a summation of the plan. But when you look at the plan, there are several contributing factors that are very important. There is something about HIV, you know, with all of the stigma associated with this.
But that plan does have an HIV component.
Absolutely. There are monies that have been set aside to address all of these programs that are included in the plan. So again, what I gave you were just highlights of this particular program. But I think it's a very significant plan. It's important to say, though, that we won't expect, you know, and that's why, you know, we pride ourselves in having a country of democracy. You know, some people are not going to like the plan because they think it's advocating a single-payer system. That's not necessarily true. This plan provides individuals as well as small firms an opportunity to select, you know, from other insurers, you know, on what you are able to afford in a lot of ways. But the important thing is that the government wants to be there. The government wants to improve efficiency. And when I talked about remember I mentioned the reserve fund earlier on, you know, that fund is going to be funded through two sources. One is going to be, once we cut out all the pork, you know, all of the inefficiency we had before, all of the monies that have been spent in the healthcare system that are not supposed to be spent in the first place, these monies are going to be used to continue to fund this reserve. That's number one. And then, of course, we'll generate new funds, you know, so other sources that will be used collectively to fund this particular effort. So again, it's very important, but the critics are going to be there. There are those who are, like I said before, are going to say, you know, it's a one-payer system, and we know some of the disadvantages associated with the one-payer system, which some people are now trying to blow out of proportion. They say it's very complex, you know, and the United States is a very culturally diverse population. So maybe just because a one-payer system might work in Canada or maybe in Britain doesn't mean it's going to work in the United States. There are those who argue that it's going to run down the facilities, you know, because everybody is going to think, oh, it's free for all, and then there's, you know, going to be all of those disadvantages. So we have to think about all of that.
But in all of your work in public health, do you believe that this is a very, very efficient kind of plan in terms of trying to meet the needs that we have dealing with health in the United States?
I think as the plan itself says, you know, this is an improvement on what we had before. So the point here is we are not looking at something that is going to be a total panacea to the problem, but we are looking at something. If you have a country, as we know the United States, spending, you know, a more significant part of its GDP on health, more than most other countries, if not all, in the world, and yet we look at the outcomes that we have, you know, being less than acceptable for the most part, you know, or especially in comparative terms when you look at what other countries that are spending less are getting in terms of outcomes, you can see why some people are very frustrated. So again, I don't think it's a perfect plan. You know, the more we try to scrutinize it, the more you'll find that there are advantages and disadvantages. But I believe at this point, on the basis of what I have seen in the plan, that it's, you know, it's a step in the right direction.
Very good. And of course, let me thank you. We've got about a minute and a half to go here, Dr. Kanu. Have you got any final statements that you'd like to make in reference to this plan? I think we might have about a minute before we end the day. What are some of the final things that you would like to say?
Well, especially for those of us in the health sector, I think it's very important for us to try to read it. You know, it's one thing sometimes to be an armchair critic. You know, it's good for you to see something, try to understand what it's proposing, you know, and look at both sides of the coin, and then try to make criticism so that when those criticisms are levied, they can be justified in their attack. I think that's very important, but as a people, I think we have to continue to focus on prevention very heavily. We have to observe, we have to pay more attention to our lifestyle. When you look at causes of premature death, you know, 50% of premature death are explained or are a function of behavioral lifestyles. You know, 50%, and then you have the other 50%, you know, sort of shared between genetic factors, environmental factors,
but it is something that can be prevented.
Exactly. You know, so again, these are very important.
And of course, Dr. Kanu, we're almost out of time, and let me thank you for bringing that excellent information about the President's health plan. And I do believe, as you've indicated, that it is a plan that has a lot of merit to it.
Absolutely.
And of course, let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.